I need your full attention for the next 2 minutes. What I'm about to show you can lower your blood sugar. Right now, Ekwarka. Not later today, not tomorrow, but within minutes. There is one simple method that can drop blood glucose by the 30 to 50 points in under 2 minutes. No pills, no injections, no special equipment. And in just a moment, I'm going to guide you through it step by step. But this video is not only about a 2-minute technique. This is about something much bigger. This is about the complete system that stops type 2 diabetes from destroying your body. The same system taught in expensive medical programs, diabetes reversal clinics, and private consultations that cost thousands of dollars. I'm giving it to you free because withholding this information is costing people their feet, their eyesight, their kidneys, and their lives. My name is Dr. Emily Carter. For over 2 decades, I worked with patients suffering the consequences of uncontrolled blood sugar. I've seen amputations that never should have happened, heart attacks that could have been prevented, strokes that didn't need to occur, blindness that developed silently over years. And almost every time, the tragedy was the same. People were given medications, well, but never given a real protocol. They were told to eat better, but never taught not how. They were monitored, but never empowered. Before I show you the 2-minute method, I need you to understand what happens when blood sugar stays high. Because once you truly understand this, you will never ignore your glucose levels again. Let me tell you about a patient I'll call Robert. Robert was in his early 60s when he was diagnosed with type 2 diabetes. His fasting blood sugar was close to 190. His long-term average, his A1C, was over 8%. He was started on medication and told to cut sugar and exercise more. Robert tried. He stopped drinking soda. He avoided desserts. He believed he was doing the right thing. But no one explained that white bread, rice, pasta, and potatoes affect blood sugar just as aggressively as sweets. His glucose numbers stayed high, so the medication dose was increased. Then another drug was added. Still, his blood sugar never truly came under control. And here's the part most people don't understand. High blood sugar is not just a lab number. It is a toxin. Every hour glucose stays elevated, it damages the lining of your blood vessels. It inflames arteries. It stiffens tissue. It poisons nerves. It starves cells of energy while flooding the bloodstream with sugar. The damage is silent until it isn't. A few years later, Robert noticed tingling in his feet, then numbness, then burning. This was diabetic nerve damage. He was told the damage was permanent. Medication could dull the pain, but the nerves themselves would not recover. Eventually, Robert stepped on a sharp object and didn't feel it. The wound became infected. Healing was slow, right, because high blood sugar prevents proper immune function. That infection led to surgery. Then amputation, toes removed, part of the foot gone. And the diabetes didn't stop there. Vision problems followed, then kidney damage, then dialysis. Robert's life became medical appointments, procedures, and limitations, not because diabetes is inevitable, but because no one taught him how to control blood sugar correctly. And this is where everything changes for you. Because what I'm about to show you could interrupt that entire process. Now we get to the method. This is the foundation. The 2-minute method that lowers blood sugar immediately and retrains your body to respond better to insulin. It's called intense muscle activation. Here's how it works. and then we'll do it together. When muscles contract forcefully, they pull glucose out of the bloodstream without needing insulin. This is critical. Even if you have insulin resistance, even if medications aren't working well, muscles can still absorb glucose directly. That's why this works needs every time. The key is intensity. Gentle movement is good for health, but it does not create the same immediate glucose drop. You need strong muscle contractions. Here's what to do. If you can stand, do squats. If you can't stand safely, sit in a chair and perform fast sit-to-stands. You will do this continuously for 2 minutes. Not half effort, not slowly. Strong, repeated movement that makes your muscles burn and your breathing increase. In a moment, I'll guide you through it. And after we do this, I'll explain how this one technique becomes the entry point to a full system that can actually reverse type 2 diabetes. Stand up now, or sit in a sturdy chair. We're starting down, up, again. Keep going. Your muscles are pulling glucose from your blood right now. Every repetition is lowering your blood sugar. Keep moving. 30 seconds in. Do not slow down. 1 minute. You should feel heat in your legs. That's glucose being used. 90 seconds. Push through, final 10 seconds. Everything you have, and stop. Take a breath. If you check your blood sugar now, many people see a noticeable drop, sometimes 20, 30, even more points. And this is just the beginning. Now listen carefully, argue, because this is where most people fail. They try the 2-minute method once, they see a drop, they feel hopeful, and then they go back to life as usual. That's like pumping water out of a sinking boat once and saying, "Great, we're safe now." No, the 2-minute method is powerful, but it works best when you use it as a tool inside a system. So here's the rule that changes everything. The 2-minute rule. Do the 2-minute muscle activation. After meals. Not before, not randomly. Why? Because the biggest blood sugar spike happens after you eat. That spike is what damages your vessels, your nerves, and your organs. So if you interrupt the spike early, you prevent damage before it accumulates. A simple plan looks like this. Eat your meal. Wait a few minutes. Do the 2-minute movement, then do gentle walking if you can. That combination hits blood sugar from 2 directions. Intense contraction pulls glucose rapidly. Light walking keeps glucose lower as digestion continues. If you do this consistently, you're not just lowering glucose once, you are retraining insulin sensitivity. And now I'm going to show you the complete protocol that builds on this. The complete protocol. I'm going to simplify it into 5 pillars. Not overwhelming, not complicated. But if you do all 5, your numbers can change dramatically. And yes, you still follow your doctor's plan. This is supportive, not a replacement for medical care. Naragur Pillar 1. Meal timing. Most people eat from morning until late night. Breakfast, snack, lunch, snack, dinner, snack. That means insulin stays high all day. And when insulin stays high, insulin resistance gets worse. So the first change is this. Time-restricted eating. You eat within a consistent eating window, and about 8 hours. And you leave a fasting window, about 16 hours. Example, first meal around midday, last meal in the early evening. During the fasting window, water, plain tea, black coffee, no calories. This gives your body a long period with lower insulin levels. That is when insulin sensitivity improves. This alone can help a lot, but it becomes much more powerful when combined with the 2-minute method after meals. Pillar 2. Meal order. This part sounds simple, but it's one of the fastest ways to reduce a spike. Eat in this order: protein first, vegetables second, carbohydrates last, in smaller portion. Why does this work? Because protein and fiber slow digestion. So glucose enters the bloodstream more slowly. Slower rise, smaller spike, and smaller spikes, less damage. If you usually start with bread, rice, or sweet foods, reverse it. Protein first, vegetables next, carbs last. Here's pillar 3, movement timing. Here's the mistake many people make. They exercise at random times, then wonder why sugar still spikes after meals. Your timing matters. The best pattern is 2-minute method shortly after meals, then a gentle walk. And the walk does not need to be intense. A calm, steady walk is enough because muscles keep absorbing glucose while you move. If you can't walk, do seated leg lifts, toe taps, arm movements. The rule is, don't eat and then sit still for an hour. That's when the spike quietly builds. Pillar 4, strength training. This is the long-term engine because muscle is the main tissue that uses glucose. More muscle, more storage, lower blood sugar. You don't need a gym. You need consistent effort. 3 days a week, do resistance work. Chair squats or sit to stands, wall push-ups, resistance bands, light dumbbells, standing marches, step-ups on a low platform. Your goal is not perfection. Your goal is muscles working hard enough to adapt. Even small strength training done consistently can improve insulin sensitivity. Dulker's pillar 5, recovery. This is the part most people ignore, and it silently ruins progress. Poor sleep increases insulin resistance. One bad night can push glucose higher the next day. Aim for stable sleep, consistent bedtime, cool dark room, no screens close to sleep. Stress hormones raise blood sugar. So even if diet is perfect, stress can keep glucose high. A simple breathing routine helps: slow inhale, short hold, long exhale. Do it in the morning and before bed. It lowers your stress response, and that supports better glucose control. How this looks in real life. Let me give you a simple daily template. Morning, water or plain tea or black coffee, light movement if possible, no snacking. First meal, protein first, vegetables second, carbs last, after meal, 2-minute method, then gentle walking. Second meal, same pattern. Evening, no late night snacking, calming routine, good sleep. That's it. No magic, no extremes. But consistency turns this into a life-changing system. Will this work if I'm already on medication? Yes, and this is extremely important. The 2-minute method and the full protocol. Do not fight medications. They work with your body. Medications help push glucose down. Muscle contraction pulls glucose out directly. 2 different mechanisms. They complement each other. However, and listen carefully, never change your medication on your own. What usually happens is this. People start using the protocol. Their blood sugar improves. Their readings drop consistently. Then their doctor reviews the data and says, "We can reduce your dose." That's the safe path. What if my blood sugar drops too low? This is a real concern, and it's a good question. Low blood sugar usually happens from too much medication, skipping meals without supervision, intense activity without awareness. That's why you monitor, especially at the beginning. The good news is this: the 2-minute method uses muscle demand, not forced insulin release. That means your body takes what it needs, not more. Still, if you feel shaky, dizzy, or weak, sit down, check your glucose. Follow your doctor's advice. Safety always comes first. Doctor, how fast will I see results? Some people see changes the same day. Others take a few days. Here's the pattern I've seen again and again. First week, post-meal spikes are lower. Second to third week, fasting glucose improves. After several weeks, averages come down. After a few months, A1C improves. This is not instant magic. It's biological adaptation. And biology responds to consistency. What if I'm older or have mobility issues? Then this protocol becomes even more important. You do not need perfect squats. You do not need athletic movement. You need muscle activation. Chair sit to stands, marching in place, seated leg presses, wall-supported movements. If muscles contract, glucose moves. Age does not block this mechanism. In fact, older adults often benefit more because muscle glucose uptake is so powerful. What should I avoid? This matters. Avoid these mistakes. Doing the 2-minute method once and forgetting it. Exercising only before meals. Eating late at night. Sitting for long periods after eating. Chasing perfection instead of consistency. This is not about intensity. It's about repetition. A simple weekly plan. Let me simplify everything into a realistic starting plan. Week 1. Choose 2 meals per day. Do the 2-minute method after those meals. Add short walks if possible. Do not change medications. Week 2. Add meal order. Protein first. Keep the movement. Start time-restricted eating gently. Week 3. Add light strength training 2 or 3 days. Focus on sleep consistency. This prevents overwhelm. Progress beats pressure. The truth you need to hear. Type 2 diabetes does not destroy people overnight. It destroys quietly, day by day, spike by spike, year by year. Most damage happens after meals. That's why the 2-minute method matters so much. It interrupts damage before it becomes permanent. This is not about chasing perfect numbers. It's about reducing exposure to harm. And every time you move your muscles after eating, you are protecting your nerves, your eyes, your kidneys, your heart. Final message. If you remember only one thing from this video, remember this. Your muscles are not just for movement. They are a metabolic tool. Every time you activate them, you lower blood sugar. Every time you lower blood sugar, you protect your future. Do not wait for complications to motivate you. Start after your next meal, 2 minutes. That's it. I'm Dr. Emily Carter. Subscribe if you want practical, science-based guidance that actually works. Share this video with someone who needs it, because this knowledge saves lives. And I'll see you in the next video.